colleagues, friends, ladies and gentlemen. It is my pleasure to be joining you today from Nairobi, Kenya, through this video message for the 17th International Conference on Urban Health. Many thanks to the organizing committee for bringing together urban health professionals from across the globe at such a pivotal time. The last 2 years have highlighted how intimately tied the public health and urban and territorial planning goals truly are. Cities have been at the forefront of the battle against COVID-19, facing great challenges, but also rising to the occasion by implementing innovative planning strategies to encourage enhanced resiliency, social distancing, and fast economic recoveries. We have seen how related the challenges of the pandemic and the barriers to healthy urbanisms are. Unregulated urban growth led to overcrowding and worsened the spread of COVID-19 in many urban areas, while patterns of sprawl have resulted in decreased access to essential health services. At UN Habitat, we understand that eco-social health needs are the guiding force for sustainable urban development, and cities have a crucial role to play in achieving global health goals. Last year, we published the Sourcebook for Integrating Health in Urban and Territorial Planning, which shows how urban and territorial planning can be an enabler for health and the well-being in cities, working to counter both communicable and non-communicable diseases, improve air quality, public spaces, and access to essential services. In the pandemic response, we monitor closely the local COVID-19 impacts and patterns. This makes it possible for local and national leaders to identify hotspots of the virus spread. With this in mind, UN Habitat and CityIQ launched a platform, the COVID-19 Readiness and Response Tracker, that assesses the daily capacities and responses to the pandemic, encompassing 1,700 cities around the world. The platform helps local governments to prepare an adequate response using evidence on the state of cities before, during, and after the pandemic. Moreover, this data analysis correlates strongly with the guidance given in the Sourcebook for Integrating Health in Urban and Territorial Planning. Earlier this year, UN Habitat published a publication on cities and pandemics towards a more just, green, and healthy future, an in-depth report on how cities have been affected by COVID-19. The report invites us to rethink the urban structural inequalities which have been exposed and enhanced by the crisis. Debates on the health dimensions of space, such as urban density, morphology, public space, housing, and urban infrastructure, have been taking the center stage. For example, we found out that overcrowding has emerged as the predominant driver for the spread of pandemic in cities. However, we also discovered that high density in a context of well-planned proximity was a key factor to ensure better response, coordination, and equitable access to public services. The current global health crisis has transformed into a severe socio-economic crisis. The pandemic has exacerbated the multiple deprivations already experienced by the urban poor communities. Another example of inequalities highlighted by the pandemic is the growing digital divide between urban spaces, communities, and different types of employment. At the same time, the COVID-19 measures put in place by authorities have shown that governments are capable of rapid transformation. This is why this year's theme of transforming our collective urban future, learning from COVID-19, is so important. This conference is an opportunity to better understand the challenges that health and urban planning professionals face in achieving shared goals by an interdisciplinary action. UN Habitat is committed to this collaboration as a facilitator and convener between stakeholders by providing technical assistance and helping with capacity building across urban-rural continuum. It is our goal to improve urban resilience and well-being while focusing on the most vulnerable population within cities, ensuring that we leave no one and no place behind. We must work in line with the prescriptions issued by the World Health Organization Manifesto for a healthy, just, and green recovery to plan better connected, more socially inclusive and resilient spaces to promote healthy and sustainable food systems and invest in healthier environments. Let us raise our ambition to have more cleaner, greener, safer, healthier, and happier cities. I wish you a fruitful conference, and we look forward to reading the outcomes of your deliberations over the next few days. Thank you.